Hey, everybody. It is Tyler and Mark here. We wanted to make a public service announcement before we start episode 12 of the Buffalo Community Podcast. We were actually invited to talk with the county from the Public Health Department and one of the commissioners and sit down and talk all about COVID-19. We did ask you to provide some of the questions that you wanted asked, and we're going to jump right into it. Mark, why don't you tell us what this is and what it's not?
Yeah, sure. So we had Christine Hewsome and Sarah Greisich in, and we were looking to get just factual information. Nothing with a political slant, but nice to hear from decision makers to a certain extent, people with accurate information and not just what we're maybe seeing and reading on social media. But so we had a good conversation with both of them, and hopefully you enjoy it.
Yep. And before we do our introductions, I want to thank everybody who's listening. If you can, please share this video. Please share the podcast. Leave us a review. Share this with your neighbors. If you know anybody that is interested in this, please share it with them because we really enjoy bringing it, especially this episode. I think it's a great piece of information for everybody in the Buffalo area to have. With that, let's hear our introduction. I love this introduction, by the way. I absolutely love it.
This is the Buffalo Community Podcast, all about the greatest small town in the USA, the people in it, and how it all works together. Here are your hosts, Tyler Reese and Mark Benzer.
Hey, looks like we have a full computer screen here. Our guests here are, we'll let them introduce what their titles are here, but we have Sarah Greisich and Commissioner Christine Hewsome with us, along with, of course, myself, Tyler Reese, and Mark Benzer. Thanks for coming on, guys.
Thanks for the invitation.
So let's just start with the invitation, or not the invitations, the introductions. Sarah, why don't we start with you?
Sure. My name's Sarah Greisich, as you so nicely pronounced. Good practice. And I'm the public health director here for Wright County. I've been the public health director for about 2.5 years. I live in Delano. I'm a Minnesota native. This isn't my first emergency response to a public health emergency. I was around for Ebola and H1N1 responses. However, I think you probably recognize now that we're into this type of response for a while that this is history-making, unprecedented, mind-boggling, and long.
All of the above.
Yes, so it's brought its own unique challenges to us. Every county or multi-county jurisdiction in some cities have what's called a CHS administrator. My job is defined in statute. And in this case, I'm acting as that administrator, and I have a direct relationship with the health commissioner. So her orders then flow through us at the county that way. So that's a unique relationship that comes out in these types of emergencies.
Sure. Well, thank you for filling that position for Wright County. We're glad you're in charge. Chris, a little bit about yourself.
Yes, I'm in my 8th year as a Wright County Commissioner. I live in Buffalo, and we were very thankful when Sarah joined our public health as the director. She's just been very outstanding, and certainly when you have something like this, a pandemic, that it calls for immediate response, Sarah, working with emergency management and the whole team, have been on the front lines for weeks now. When the president and Governor Walz both declared states of emergency on March 13th, the following Tuesday, the county board then also declared a state of emergency in keeping with the federal government and the state government. And as county, of course, we are an arm of the state. And we, the next day then, we called an emergency meeting just to, okay, what do we need to do? And recognize that first thing we needed to do was to close our public counters. And we also sent most of our staff home so they can start working from home. And fortunately, we now have a pretty robust virtual personal network. Thanks to Mark Kellogg in IT, when he came on board last July, he recognized that we were not prepared for something like this, and his work was, as it turned out, came in, extremely handy, because he actually stayed up all night setting up 170 people on virtual personal networks. And so with 740 employees and about 240, I think, in health and human services, we're able to send the majority of our staff home, and they can work from home. So that's been a blessing. We had already implemented some of our employees in human services to work from home. So they telecommute essentially. We're doing a pilot program with 12 per year, but that was before our system was as robust as it is now. And it's proved to be, a win-win situation, because they actually have proven that they're able to get more work done. So of course that not everyone can do that, but we do have a great number of employees that can.
That's it's an interesting fact, because I think that would have been one of my follow-up questions of, with the working from home and the COVID response, of are things getting done? There's so many people that might have an opinion about that, but I'm glad to see that productivity can happen, and there's a big team behind that. And,
definitely, and certainly, the deputies are still on the road. I mean, we've got other people that are, the parks and that kind of thing, the highway guys, they can do their job, and they're not in the offices necessarily, and they're out, certainly have the social distancing, and when you're working outside too, of course, that's a plus. So
yeah.
So
staff. Yep.
are you guys hearing an echo?
Yep. Here.
How about now?
Say it again.
Can you hear me?
Yep. That sounds normal on my end.
I don't hear an echo.
Okay, sounds good. So as we started hearing about COVID, in January, and it was kind of something that was happening somewhere else. At what point, when kind of all of this is beginning and it's kind of in the early stages of everybody's radar, are you starting to, put plans in place for the, what if this thing blows up? What are we going to do when it gets here? So I guess, is there a timetable of kind of when we all started to hear about it and when it becomes a call to action for you?
I'm guessing that question's directed at me.
Yeah.
So in public health, we started joining calls with they were often facilitated by the CDC and NACHO, which is the National Association of City and County Health Officials, which is the organization we belong to, where we get a lot of guidance, situational updates and awareness pieces as information became clear. I distinctly remember things around Washington State and Seattle area, just really meeting on a weekly basis. We do have plans that are worked on. We do get a small amount of emergency preparedness funds from the federal government. And that, I would say that money's not necessarily sufficient in the past, but it was enough to have some bare bone things and some staff together. Primarily our infectious disease staff, public health nurses, and our emergency preparedness planner, and our PIO, or public information officer, and myself and the supervisor, meeting on a regular basis. Certainly, if I remember my dates, the first case in Minnesota was a Friday. Was it the 6th? And then we just sort of began being prepared for when we would open our department operations center which our plan was that we would open that when we had our first case. We decided actually to open it a few days before we had our first case on March 13th, which is a Friday. Happened to be the day after my son's birthday.
Oh, sure.
And then it lands on Friday the 13th.
You're
Yeah.
right.
Correct. Everything happens on Fridays.
Yeah.
Bad things happen on Fridays. And then we basically have been working in some degree of incident command structure. It's been modified several times, which is also true for the state. As this response grows and also gets into a longer response, as issues that people did not anticipate, like what's happened in Wilmer and in Nobles County as well with.
What's happened in Wilmer?
Those are the meatpacking incident, outbreaks, I should say, not incidents, but outbreaks. Those are things that I would say were not anticipated. And they started in other states, but then we saw them here. And I think a lot of it was when we knew to look for them. And we, as the general public health, I don't know if it's necessarily, in that case, it was really Minnesota Department of Health working in tandem with a lot of folks in those counties. I would say the silver lining for Wright County is that we haven't had something quite that significant happen to us. It's been a slow, steady growth of cases. And that has allowed us to do some really intensive community engagement with our schools, our long-term care facilities, which is another high-risk area and places where people have wanted to focus a lot of attention in their counties. We also are working with our businesses, primarily around ones that it's difficult to do social distancing where they may be in close quarters. Planning for our agricultural community because we knew that was coming and we've been talking about that for a long time. So a couple of us were really leading the way on that. Benton County being another partner in that response and really driving some of that conversation with the Minnesota Department of Health, which has been exciting to see us lead the way with that because we know how important our agricultural community is to us and their success. So making sure that that's done well and they have what they need. And then, making sure as things go longer, developing points of contacts for those summer events and communities and working with our Chamber of Commerce so that they have people that they can connect with as they try to troubleshoot things and understand what's happening. So it's been a long response. And just recently, we, along with several metro counties, as well as Stearns and Olmsted, so where Rochester is, are going to be taking directly from MDH our cases and doing case contact and investigations locally to provide that service here with our public health nurses.
So when you say the plan, or we're planning, a follow-up question, and we took to our followers and asked a bunch of people, what questions do you want to ask the county on what their plan is? Because I think that's a really big conversation going on right now. And Joel supplied us with some of the resources of where you guys are located in talking and where they can find that information specifically for the county. And that's going to be in the link of wherever this is posted. But what is the plan when there is planning for those businesses? Is there an outline of it that people can look at it, or is it just kind of talking heads of what do you think? Because it seems to change every day. I mean, depending on where you're looking.
So I think that's exactly a really good point why it's nice to have that personal contact, right? So we have a hotline, which I believe Joel shared with you, and that's that 763-682-7607. And we filter calls. Some of them are people who are concerned that they've had an exposure, or they're concerned about their health or their symptoms, or they're having trouble accessing something. But some of them are people saying that, I was planning this event. What do you think? And generally it's a couple of folks that are in that team that work on the community engagement piece, and we've offered ourselves to be available. We talk through it with them, and kind of say, okay, what are you planning? Okay, how's the social distancing? Okay, if it's before this date, it doesn't meet the executive order. If it's after this date, if necessary, I go to our county attorney, which has happened, just get some, legal guidance on some of these things, or if there's some crossover with county business. And really it's troubleshooting and talking through what they're thinking. Many of them are thinking in advance. Most of these events always, not always, but they require a lot of planning. They're getting vendors lined up early and thinking about food, and all of this stuff doesn't turn on a dime. And many people wish I had a crystal ball, which I don't. But it's really helping them read the guidance. And then honestly, there's pieces in different places, right? So if you're an outdoor recreational facility, there's stuff on DNR's website. And if you're doing this, it's over here. And so it's really just saying, okay, let me help you find it.
Sure.
And understand it.
So what I'm hearing is Wright County's fallen in line with the state's guidelines of the plan, of the social distancing, keeping things closed. There's no variable of that's Wright County specific, is we're falling in line with what the state is recommending, correct?
Well, yeah, so we don't have jurisdiction, and nothing that the commissioners have put forward, and Christine, you can correct me if I'm wrong, has said that we're doing anything different than what the orders from administration have. And I know that was, we're in, to a bit technical, but we have what's called an incident command structure. It's something that actually came from firefighting, wildland firefighting, to ensure good communication. And we actually do that structure right now, where I'm an incident commander and I have somebody from the sheriff's office, our emergency manager, alongside me. And so there's lots of communication about, the stay-at-home order and concerns about, people have a process for filing complaints. They know how to reach the sheriff's office and all of those pieces. But we don't have guidance to do anything other than what has been provided by the governor's office.
Sure.
So I know that there may be some municipalities or some folks who say, like, we're not going to follow this. I've not been told that by our commissioners, and that's who I work for.
Sure.
So, and I wasn't meant to be necessarily passing the buck on the question, but honestly, that's where the information is. And so,
well, I think it's a great segue. One of the questions that we received was, how does the county enforce that, or do they? And maybe that's a question for you, Commissioner. How does the county enforce social distancing?
I don't think that, the county necessarily, we do have our guidelines at our county buildings. However, because we don't really have many members of the public coming into our buildings right now, we have, the public windows are closed.
Mm-hmm.
They can pick up the materials. They, I think I mentioned this, there's a booth, a kind of a plexiglass booth that people that are applying for marriage licenses can make an appointment and meet with our recorder's office on those kinds of things. But generally speaking, when we are planning to reopen our public windows, we're going to have different things in place. For example, we'll have the sneeze guards, the plexiglass windows, that kind of thing. And if there's places that form lines like the DMV, we will have that marked off. So you'll have the 6 feet and that kind of thing. So for as long as these suggestions or requirements, whatever you want to call, to help stop the spread of COVID, we'll continue to implement those. And we're looking into getting the face coverings, masks, and also if we require or request members of the public to wear them, we're talking about, well, if we're going to do that, we should really provide some. So there's a lot of those kinds of unanswered questions, but certainly a lot of people are wearing the face coverings and masks now. I was in Menards a couple of days ago and everyone had a mask on, I kind of, including me, but the staff, and when you walk in, they say, thanks for wearing a mask. But my understanding was that you need to wear a mask now. So there's some of those requirements. And I think those measures will probably help more businesses to open. So depending on, what the next order is, I mean, the governor, closed essentially so many of the businesses until May 4th. And then we got a few days from May 4th. He says, no, we're extended to May 18th. And then looking at, what can we open, and certainly, encourage people to use the curbside, but you can't use curbside in all businesses. It works well with food and that kind of thing, or you order something, you can, or go to a paint store and order your paint. Well, maybe you can't go into the store, but they can bring it out to your vehicle or that kind of thing. So there's measures that people are taking, and but it's, one way that's been described many times is this is a very fluid situation where we're maybe just taking it 2 weeks at a time, which, it's very frustrating for people. I understand that. I mean, I had 3 family members that essentially their businesses stopped. And so it's difficult for a lot of people. Unfortunately, there is the help from the state and from the federal government. It may not certainly be ideal for most people, but at least there's some help.
Mm-hmm.
And so as far as what are we seeing in Wright County specifically, there's a lot of talk about available rooms and ventilators and things like that. What do we see? I think what we hear from more broad, like national media and maybe larger, more large local media outlets saying there's a shortage of beds or ventilators, things like that. What are we seeing right here in Wright County as far as are those resources being exhausted right now?
So I think, so right now the situation, we had 60 cases reported this morning on MDH. I'd have to...
Specifically in Wright County.
Specific to Wright County, yep. I think it's certainly have a large portion of our border with Hennepin County, which has the highest number of cases, not cases per population, but the highest number of cases is, it has an impact. We have a lot of folks who live in Wright County who commute to the metro. We definitely have community spread, which means that folks are getting exposure from unknown sources. So there's not necessarily, I got it from this person. I just became sick and I don't know where that exposure happened. Some of that is because as this has evolved, so is our understanding of the virus. The disease course can be very unique for certain individuals. There's a lot of unknowns, and if I had one thing where I knew all the information tomorrow, that would be the one that I would pick, because it is really what's making this so difficult.
Yeah.
Some people are possibly infectious for a period of time, but not symptomatic. We don't know how much of the population is like that. Certainly there's some things around, are kids carriers or are they just not getting it? Some kids are, but they're still, when they do get sick, all sorts of questions.
Right.
You asked about a healthcare capacity, as testing has opened up in the past week, and that was really a directive from the governor's office, and I think he was calling it his moonshot, or Minnesota's moonshot, I should say, was really so that in order for us to have those businesses open, we have to be able to do this intensive case investigation, case finding. And then when we find someone test positive, we work with them so that they can isolate at home safely, and then make sure they're supported in that process. And then eventually go back to their regular life, but it's only 10 days or 12 days, depending on how they're doing, or maybe 2 weeks. Hopefully they do okay with the illness. And it's not months of staying at home without access to work and employment and school and some of those things. So it's really changing our response. And that's what has worked in other countries. Certainly, we also in Wright County, even though we're finding guidance from the governor, we look at what other states are doing. We are looking at what's coming from the international level, as other countries have gone through this a little bit longer than us, coming out the other side. There's certainly lots of unknowns. As far as our healthcare system, we have access now to 2 testing locations in the county, and one more. There is a website that's run by the Department of Health, and I think there's probably some assistance from the U of M and the Mayo in that as well, that helps direct people to open testing clinics. We have identified a gap for access to testing along the Highway 12 corridor and southern Wright County, northern Carver County, into areas of McLeod and that portion of West Hennepin County, and trying to troubleshoot with those providers. So that's kind of one of our projects, and we keep doing that, right? So that's part of the planning, is what's our plan, also much like what Christine said, is for the next 2 weeks, like what do we need to get done, and then it changes. So we've changed our operational response, as I mentioned several times.
Do we know what that shortfall is? You hear stories, and I'm basing the question off of that, of, well, I can't even get tested. Now, I mean, is there a line, is there that avenue of, hey, I'd like to get tested to see if I have it, or the antibodies, or insert all of those above? But we hear people getting turned away. Are they turning away non-symptomatic people, or is there something that the county sees as far as the Department of Health or anything like that? Can you just go get tested because you want to be tested, or does something have to happen?
So our healthcare providers is the ones for Wright County. I can't speak for maybe
Right.
You drive several miles, away. Are all requiring some type of visit. Most of it's virtual, right? They're talking to you on the phone or doing some sort of Zoom, or I'm not sure what their platform they're using, but everybody's probably a little different. So I don't want to say they're all using the same platform, but they're using some sort of video chat with you to talk about your symptoms. You do have to be symptomatic to get tested at this point, unless you're like a healthcare worker, or you're like, there's something going on in the long-term care facility, or I know for some outbreaks. So I don't want to say that, you can't get tested, but most people, if it was just like, I think I'll get tested today, I have no reason to, I feel fine, I have no known exposures, that's really not a good use of our healthcare resources, and they'll turn you away. We're not at that level. That's kind of what you would do in a research study if you wanted to see kind of where we were at. What we're trying to get is anybody who has a symptom that they can get tested, and that has been done pretty well. It has changed rather quickly though. So I think people previously, even a week ago, would have been told, nope, sorry, we can't help you. That part of having that website set up and some of those pieces is to really open it up. Now, I think the issue that we have is you're going to have to drive. And that's why we're trying to get some of those gaps filled, because up until hopefully tomorrow, we'll see a big boost. There's actually, since we're on a Buffalo podcast, there's a big tent going up next to a line of Crossroads. So I went and checked it out and talked to the clinic manager today. So that's going to be drive-through testing, and they do something similar in Maple Grove. And then we have stuff at South
for symptomatic people. So don't go drive over there yet.
Don't go drive over there. And you always have to be, like, as I said, you always call your healthcare provider first. They're not going to test you unless you get pre-screened.
Sure. Okay.
Yeah. And then, but that'll be one that people can be directed to. And that is going to really increase our capacity to reach people. Of course, as soon as we open up the number of tests, we're going to see a big increase in positives. That's what's happened across the state. So to date's number, we're like 600 and some positive tests out of 3,000 new testing that was done. So that's the converse, right? We're finding how much is really existing in Minnesota that we kind of thought was there, and people weren't able to get tested.
Yep. So the expectation is, there's going to be more positive tests as testing becomes available.
Absolutely. But it's helpful for people to know. And then some people have very mild symptoms, or some people, their symptoms are mild, but then, they get sicker later. So it's helpful for them to really know what's going on so they can communicate well with their healthcare provider.
That kind of a little bit maybe answers the question that I've had, where and maybe this is something that's changed, but I had initially thought that, hey, if you have symptoms and they're manageable and maybe you're not feeling severe shortness of breath or a real need to go be seen by a doctor, I guess what I understood is that we were not encouraging those people to be seen by a doctor, and perhaps their symptoms pass and without even knowing for sure what the diagnosis was. Was that ever the case? Is that still the case? Was, as far as that goes?
So when we didn't have a lot of access to testing, and actually, I think it was actually one of our clinics that first recognized some of the supply chain shortages that we experienced in Minnesota. What happened was we were saying, actually, we don't have access to testing, and the healthcare system was really working with those individuals through their virtual clinics or whatever, and saying, you sound like you're okay. It sounds like COVID. And there was a lot of people who were told the language that they were using was presumptive positive, or something to that effect. As we keep going and learn more, some of the guidance has changed for how long people need to stay home before they feel better. So really, at least at minimum, we want someone who feels like they might have some symptoms to connect with a healthcare provider. And I will just let you know, just because we're worried about COVID, there are other diseases that still exist in our community that happen, right? So March and April are actually traditionally, when you look at things, kind of top months for something called RSV, which is a respiratory virus that can really hurt little babies. It's not great. It can end up with them being hospitalized, and we've had a couple of cases. It's usually it's not something that's necessarily reported and it's managed, but it's because they've just have, naive immune systems that haven't been exposed to these viruses before. So they do a COVID test and they do an RSV test, and it's really helpful to know that it's RSV, or, early in this, we had the confusion of, influenza is also circulating. So people were being tested for both. And if it was influenza negative, but they had influenza-like symptoms, they were told to assume that they have COVID. And I think the other thing is, I have a master's in public health, but I'm not a healthcare professional. And so I think it's really important to check with your physicians, because some of the symptomology has changed. Just last week, the CDC added symptoms that were there. So people may think, I don't have COVID, because they were paying attention to the news when it initially came out and talked about high fevers. Well, not everybody has a fever, but if you have headaches or muscle aches and some of these other symptoms that you wouldn't necessarily think of, they actually can be signs of COVID as we learn more. So I really think people do need to connect with their healthcare provider, and if they order the test, they should be tested. It's really helpful to know, and then we can support those individuals at the local level to understand when it's safe for them and how to keep their family members safe. So as in my personal life, I have 3 asthmatics at my house. And so if I'm symptomatic, I absolutely want to know if I have COVID and if I need to isolate, because for me, that means I'm in the basement, in my own room, using my own bathroom, away from, I wouldn't be by my husband or my kids, because I don't want my family that has the chronic illness to be exposed. So really, it's one of those things where the information can be really, really helpful about keeping some of those high-risk individuals safe.
I want to back up a little bit to something Chris said about the county's plan of maybe suggest. You didn't say required, but maybe said suggesting the PPE. Was that in public or just in public offices? The masks out in public. Is that something that maybe down the line it's been discussed that we're wearing them down the street, or is it just as you go into county buildings while you're going to do those services, behind closed doors? Can you talk a little bit more about that?
Are you asking me, Tyler? Or are you asking Sarah?
Yep, I'm asking.
Well, yes. Certainly the county doesn't have the authority to request people necessarily, unless it's an order from higher up, that we're going to be stopping people on the streets or asking them if they're walking out in the street, that kind of thing. I don't know for sure if we're going to ask people coming into the government buildings, any of them, if they'll have face coverings or masks, but there is talk of that, just simply for protecting our staff and also members of the public. So we're also looking at having face coverings for our employees. So that's something that there again, we want to keep everyone safe and prevent the spread as best we can.
Sure. One of the questions that was asked, and we're trying to keep all these anonymous, we're not name dropping, is who are the decision makers? Is it the board of commissioners? Is it the mayors? I mean, who's the group that is having these discussions? Because I know there's a lot of discussions on social media, but
right.
Forget that.
Yeah, certainly we take our direction from the governor, and that's what leads us to make the decisions. So essentially, we're following along with the state guidelines, and they're getting their information and gathering it all together from their sources and the healthcare professionals, the scientists. I mean, whoever is working on this, and so they're needing to make these decisions based on what they're learning, what they're hearing. And as Sarah said, you can look to other states, you can look to other countries, and who have gone through this process sooner than we have. And I mean, I think Minnesotans have done a fine job of recognizing that, yes, if I've got some health issues, I want to stay home. I want to isolate. I don't want to go out and risk the, getting something that might make me seriously ill or cause my death. And I know certainly that I don't want to go and expose someone, if I think potentially that I've been exposed, I'm not gonna go visit people. And I mean, yeah, it's really sad not to be able to see grandchildren and get together for family gatherings and do different things like that. But at the same time, I do see people and meet with people, and we stay our distance, but you just don't know if you've touched something and kind of accidentally rub your eye or that kind of thing. And so those are kind of the things that I think we're all thinking of more than we used to.
Sure. I think in response to that, of how it's affecting everybody else's, and there's some underlying things that are happening. We had a question from Teresa McNamee of the director at Rivers of Hope, and her specific question, as it pertains to the county as well, is that they're anticipating some increased need due to the increased intensity related to the physical and safety of the mental health of Wright County residents. Mm-hmm. And I mean, they're anticipating that. And is there any discussion at the county level, and Sarah, this might be a public health thing too, is that being addressed, not just COVID? Is there some mental health conversations going along as well?
Yeah, so I think that's a really good question. So as we look at this, our charge is the health and well-being of the entire county, not just in a time of pandemic. And so I mentioned this last week on a call that I had with some of our legislators. It's to our long-term advantage for the safety of our and wellness of our county and for people's health to have a robust economy. Whether or not you have an income and a home and food determines how healthy you are, just as much or more than whether or not you have access to healthcare or eat right or exercise, because those are critical I mean, it's, you can think about how difficult it would be to make sure that you're making healthy decisions when you're trying to think about whether or not you have a job tomorrow, right? And I know how many of us are probably just, even just with the stress of the stay-at-home order, are probably not following our normal health routines, right? So we also are tracking this idea that there's just an increased amount of stress on individuals. There are things about being both physically distant, but then creating an upheaval in our social networks where, and our supports. And at the same time that we're looking at that, and we're tracking the data, and we have some people within our structure that are specifically reaching out to some of our healthcare providers, but we're not going to be able to account for all of the changes that come with this just incredibly unique, and as I said, like unprecedented and pretty terrible situation. I mean, a pandemic is pretty awful.
Mhm.
And I think part of it is just saying it's okay to feel really bad about this. Like parents, I can tell you before I came on this, as a person, like had a conversation talking my husband down off a ledge because he's home with my kids. I mean, he works for a utility, so he's also essential. A lot of us are trying to join, and I'm so happy that both of us have our jobs, so I don't want to come across as ungrateful in that way. But all of what we're doing is unusual. And for some folks, that's going to be too much. And for any one of us at any given time, it's also just okay to say, this is abnormal and I feel bad about it. And that's okay. Like, do the best that you can. So we are looking at that. We have been working with the sheriff's office to kind of track some data to see kind of what the outcome is, anticipate some things, as we know when anytime there's a big change. So when school gets out, what looks like in the fall. I think there's questions we're thinking about when the stay-at-home order is lifted and people had relationships or different things, because super cool stuff. Like, I just want to shout out to Buffalo too. Like, there's like a whole nother Facebook group that just set up to help people connect, like helping seniors get groceries or like some of those things. In public health, I don't want necessarily to have, the government providing the groceries when the community has figured this stuff out. How do we lift this cool stuff up? That's what's really awesome. And there's always a way to pick out those really good things that are happening too and make sure we're supporting them.
Sure. I'm glad you made that point right there, because yet another question is, one was pretty blank of, can't we figure this, social distancing out ourselves as it comes to opening up businesses? I know some of the small business owners were, if you can go into Walmart and Home Depot and Menards, can't we do that at the smaller level? Has there been any talks of, opening up on the local level of saying, yeah, maybe we need to make our own guidelines as far as being safe? Or is that conversation started, or is it going to wait until there's some action point at the state level?
I can just say from our perspective, we've really only had the time to focus on the needs of the individual community members.
Sure.
Not that it's not important, but we just don't have the bandwidth, and it's probably really outside of our scope. We are really focusing on that public health response. I know I mentioned, it's important. And I think if the commissioners wanted to have that discussion, I'm not even sure if that's within their legal purview, right? To make those, and they may be able to say, we don't, I don't even know. So I would, my guess, I would let Christine answer, I guess. Maybe. Yeah. But, and I know our sheriff is talking, there was that question earlier about how are we enforcing things, right?
Yep.
A lot of it is just talking to people. It's not going in, and I don't think he's necessarily written a ticket. I know that some things have gone through different places, and that's not to say he wouldn't, and he's not here to speak for himself, so I don't want to be saying how his operations work, but most of the time our philosophy is from the beginning is to talk to people and talk it through and educate them. And some folks didn't even realize, or they are perfectly, obviously you want to work with people, not against them. And so
Yeah.
try to figure things out.
Very true. And I'd just like to add too that, there are people that are, very lonely, very frustrated, angry. I mean, I see some aggression out there that is understandable. So you have to accept your feelings and reach out. And if you need help, please contact. We have numbers on our website, so people are there to help and understand that this is not something that any of us signed up for sure. And we're in the middle of it. We have our COOP plan, which is continuity of operations, and we have had this for ever and ever. And this is the first time that I know of that's been used to this extent. So, it's amazing how you have these plans and you can open the book when you find out that, oh, we're in a state of emergency. What do we do? Open this book, and, it's amazing. Our departments all could get the plans that they needed to do to get their employees sent home, and how many people needed to stay in the building to come keep operations going correctly and to provide the services that we do for our citizens. But it was like the next day we got everyone's plans practically of how they were going to keep things going in this time. And of course, at that time, we didn't know how long it was going to go on, and it's been going on for nearly 2 months now. So it's been a challenge, and it's understandable that people are frustrated. There's people that really haven't left their homes for 7 weeks because of underlying conditions and that kind of thing. So yeah,
I go back to, I'm no different than you have. We all have our highs and lows in terms when we all go through this, but just a reminder of what's the difficult part of it is that we really do only get one chance to do it right. And it feels like we're going to know if we did it wrong more so than like we don't get a redo on all of this, right?
Mhm.
So if we act too aggressively, it's a little easier to see the negative consequences of that rather than acting maybe too conservatively. Just being patient, and we're going to get one shot at how we approach this, and there's a lot that we don't know. So
Yeah. What does Wright County need? I mean, is it staff? Is it equipment? Is it information? Is Wright County missing anything as it pertains to COVID?
You mean the county government itself or the services in the county?
Services, the government. I mean, are we lacking anything in our execution of the plan?
There's, outside things like, providing meals for some of our seniors that need help. And we, have been through Wright County Community Action, have been stepping up to the plate and delivering meals. There's also food shelves, essentially, where you can drive up and get your groceries. I think Annandale and Maple Lake have those. So there's a lot of services that way, but certainly the longer we go on, we're going to need more funding. And, there is FEMA dollars out there, so you can apply for that, and, if you need it, and perhaps get it, and then you, I think, pay back 25%. So going forward, Wright County is, I think the commissioner is all pretty committed to keeping our budget, as low as possible this year, recognizing that people have lost their jobs, they're struggling, and we, property values have gone up. We've gotten our property statements, and our property certainly has gone up from last year. So knowing already that their taxes, if we kept the budget zero, you're still going to see a little increase in your taxes, but we want to do what we can to help people that way.
Sure.
So I think, yeah, just to elaborate on what the commissioner said, our nonprofits are doing a lot, our food shelves and our food banks, and to support them. And many of them, if you reach out, they'll tell you the best. I mean, it's really difficult for them to take food donations right now and some of those things, but cash donations or checks or, and I know for some people that's not feasible, but those informal things that people are doing where they're checking on their neighbors and helping each other out, that's, you can do that from 6 feet away.
Yeah.
And it tells tells people in our community that they're cared about and important, even when it's stressful. Those are the things that I think when we think about the values that Bounce Back in the community has brought forth, and we just want to kind of reiterate those things, that people have a network that they can support, even though and some people, their network is completely disrupted. And so really just doing that concerted effort. And I have to say, I mean, when for sometimes expressing that gratitude or that thank you to somebody else or making someone else feel good can really help you out at the same time. So those are just some things to keep in mind. Those are the things that really, I'm sure as we reach things, there may be things that we hadn't anticipated. For those people in the community that are interested in volunteering, there's something called the MRC, which is the Minnesota Response. And that is a volunteer corps that's run. It can be medical professionals, but it can also be other types of individuals. That I'm sure that information's on our website, but you can also Google Minnesota Response and look that over. As we go into a long-term response and we think about different areas, those things around long-term care and some other pieces, there may be some need for some assistance with staffing. That's things that we've heard, and those volunteers are going to be helpful. So those are some ideas for individuals. I think I have to say, one of the things I'm super proud of and was so lucky in joining the county is the skill and quality of the public health workforce here. All of the staff are just amazing. Some of them are working from home. Some of them are reporting. Some of them, we have to provide not 24-hour, but 7-day a week coverage for our case contact investigations, and are willing to do that. And we're also being, thoughtful about how we administer that, so we're not incurring extra costs. But being able to give up a weekend to make sure that we can do what we need to for our citizens. These are folks who, generally speaking, the county hours are a little different. And we have healthcare providers in our community that are just going above and beyond to meet the needs of our community members as well. So those folks are, I get to, like I said, I get to be the boss lady, but they're the ones working with the individuals directly and making them feel safe and feel connected and feel like they can do what they need to beat whatever virus or disease is going on.
Sure. As we're approaching this 1 hour mark, we might get cut off here in a second, but if it does, we'll reboot it. But is there anything that that maybe there's a general misconception that we're seeing in the county that you guys would like to clarify, or at least say, hey, either no, that's not true, or this is what it is? Is there questions that you're surprised that aren't being asked? Or anything you would like to talk about that we haven't yet?
Covered a lot, that's for sure.
Yeah.
So I think it would be worth addressing this idea that this is the same as the flu. It's not. And if only it were that easy. having been through an H1N1 response where it was a flu, it was a much different response. We didn't, didn't have a president even shutting down an entire country, or countries across the world shutting down. And I know that's, it's not meant to say that in a way that is to excite anyone or get them really riled up. I think what I get concerned about, and similar to Mark's point about we only get one shot, is that I'd feel really bad if we minimized the risk of this in a way that caused someone to be hurt.
Yeah.
And I guess that would be the piece that keeps me up at night, would be if there's the miscommunication at any point that this is no big deal, and that we're all making a big to-do about nothing. We've upturned a lot of people's lives, but because it has a significant impact on individuals, and it is really tricky. And I hope someday, and I don't know when that is, we'll look back and we can say we did this right, we could have done this better. And we will do that. That's always done after an emergency. And we'll learn from it. And then hopefully the next time will be so long that I'll be retired. But it'll be, we'll learn from this, and the decisions will be more refined. But there is, as much as there's a plan, there's so many unknowns. We're all doing the best that we can. I think if there was one message I could tell you, it's all come from a genuine sense of wanting to do the best that we can to keep the most people safe, and balancing that. And I don't envy any of our state or national or world leaders in making these decisions, because they're incredibly complex and incredibly difficult.
Yeah, definitely. It's not an easy decision to close school for the rest of the year. Oh, yeah. I mean, and to, look at what are we going to do for our graduates this year, and how can we honor them? Should we have a gathering later in the summer, in the fall? It's not the same, but I mean, people are very concerned. So I don't think anyone takes any of this lightly when it comes to, the impact that they know is having on the kids, and I mean, parents, everyone. So to not be able to have a funeral for your loved one when they pass away, and it's very mind-boggling to think of what individuals are going through, because you see the ones that are in your circle, per se, your family, your friends. But I sometimes think of all the people that are going through things that I have no clue about, but we just have to keep taking it one step at a time. And I agree that we do need to start opening things as probably more of a soft opening. So it's not just, open the floodgates all at once, just, do it more gradually. So if the virus is introduced to other people or whatever, maybe it's not going to have such a overwhelming impact on our healthcare facilities. So.
And I think that's probably part of the difficult, process, is knowing that when we do open things up, you have to expect that there's going to be another spike, where there's going to be a spike with increased testing, and there's also going to be a spike when it's opened up, and making sure that we're prepared for another influx, I would imagine, and things like that. But yeah, we had a lot of questions. I think we got through almost all of them. One last comment, which is, it's just that it's a comment, not necessarily a question, but kudos to Wright County as being the first in the state to have a text hotline.
Oh, thanks.
So I just leading the way and being on the forefront of that is comforting, knowing that we live in Wright County and we have great leadership and great medical staff and a lot of smart people making difficult decisions. So thank you.
Yeah, we appreciate that.
Yeah. Yeah, we have some, like I said, I have some pretty neat staff who come up with really innovative things. And we actually had that project in the works early on before this happened, and we were able to really quickly turn it around to be able to do this. We have a very young population in the county with a lot of people who would rather text than talk on the phone.
Anybody who doesn't know, that is what texting what? Hey, I think I might have COVID. Help me.
Oh, it's a hotline. So again, they can text and say, I need, we have a bunch of stuff on our website with locations for food shelves and different resources. That's all on there as well. But it maybe say, I am having a difficult time connecting with a mental health provider. Could you assist me, or something like that? And we'll get you to the right place. It may be, I was recently exposed to someone. Can you talk to me about that?
Yep.
It could be that. Like I said, it's sort of a catch-all. So also our community events folks, people sometimes who have complaints or have questions about an activity, I saw somebody doing this, is that okay?
Mm-hmm.
We'll field those. And we also send them to the right place, because sometimes those do get sent to the state or to the sheriff's office or what have you, or we just document it, right? Thanks for letting me know.
Yep.
I do, if I get a little bit of time at the very end.
Yes.
Yeah.
Starting tomorrow is the beginning of National Nurses Week.
Yeah.
So just something I want to make sure that we highlight. We certainly have public health nurses. You hear a lot about hospital nurses who are doing amazing things, really putting their lives out there more so than usual, and wearing a godly amount of PPE, face masks and gloves and shields and all that stuff. But we also have public health nurses here in the county that are working with individuals and supporting them, and will be working with families directly. Some of the times even going to their homes. And then we have our nurses who are still seeing families through televisits, through video and phone, supporting them as they build their families. So all of that work is still happening. So I want to call out those nurses.
Yes.
Sorry. Fortunate to have the technology that we have, so we can have the Zoom, Skype, and WebEx meetings. It's not the same, but at least we can continue to meet, and the county board actually still meets in person, but we're sitting far apart on the dais, and one of our commissioners has been isolating, so we have 4 in-house, and then others can join us via the phone. So we make it work, and it'll be wonderful. We can all have our in-person meetings again, but for now, this works.
Yep.
Perfect. And as we're winding down here, if you had to grade Wright County as the public in their response as far as social distancing and how they're reacting to this on a grade A through F, how do you think Wright County is doing with that? That was a question from somebody, so that wasn't mine. That was somebody that said, "How are we doing?"
I know that there's a website that does this.
Yeah, pass fail, pass fail.
Pass fail. There is a website that does this, and I would say we're not doing so hot. We started off really strong, and I think some of that is just what we're asking people to do is really hard, really hard. And so it's that staying power is hard, and some people are needing to figure out different ways to really meet what they need to. And some people are, I do think some people are getting back to work, which is good. But then we're hoping those measures, right, that they're all on there, they're based on cell phone data and stuff, but it doesn't show you people, it doesn't tell me how many times people wash their hands or whether or not they made sure not to cough on somebody or if they're staying home if they're sick. I don't have that. So those are the things that I don't know. And I hope that everybody's doing that. And if everybody's doing those things and, meeting by Zoom when they don't have to be next to each other, giving each other space, all of those good things. And then we like to say physical distancing because we really want people to be socially connected.
Mm-hmm.
Well, maybe we'll get an A+ and we'll get through this.
Sure.
Yeah.
Sure. So it sounds like maybe like a C with some incomplete assignments.
I think some get an A and maybe some get a D.
There you go.
Yeah. Well, we appreciate you being on here. It was a pleasure talking to you guys. And maybe this is an example of, hey, everybody, you can have a conversation about all this stuff. It's okay. And you don't have to yell, shout, cuss, be mean, anything. Respect your neighbor. We're all in this together. I know I really appreciate it. Learned it a lot. Learned it. That's not even a word. I learned a lot. And I guess we can wind down here.
Yeah.
For the Buffalo Community Podcast, I'm Tyler Reese.
I'm Mark Benzer.
We've got Commissioner Chris Hewsome and Public Health Coordinator Sarah Grosich. I get it right?
Director, but that's okay.
Director. Oh,
It doesn't matter.
Nobody listens to this anyway.
Yeah.
As we're actually winding down, if you are seeing this, please share it. I hope the county can share it as well. It just helps getting more information out there. So we appreciate it. This is going to be hitting Thursday morning. So we should see it up on Facebook and YouTube and the podcast as well. So hopefully you can check out all the county links and follow it and get some information directly from them. So thank you very much.
Yeah, hopefully we can try to, I'm guessing we'll be doing this for a while. And I know I've done some other ones and I just try to check in. I mean, we're reasonable, but maybe in a while we can do this again.
Sure.
You made it rather painless. I was a little nervous. So.
Well, appreciate it.
Well, I'm glad we didn't get cut off. I don't know why we didn't get cut off at the 40 mark and then the hour mark, but
Something popped up that said that you added unlimited time.
oh, nice. I broke Zoom. I broke it. So
I told you, sir, is a wealth of information. Thank you.
all right.
Thank
Thanks,
you.
guys.
Thank you.